Hello, everybody. Welcome to the Practice Pulse podcast. And I am so honored to have as a guest today the founder and CEO of Elevate Compliance. And this here is Will Gilmore. Hi, Will.
Hi,
Welcome.
Doc. Good to see you.
Good to see you. A little bit about Will. Will has 10 years of compliance experience in the dental industry, and he has helped practices all across the country prepare for and respond to the stuff that we don't like, OSHA, HIPAA, and infection control inspections. His company, Elevate Compliance, is an all-in-one compliance platform that aims to make annual training, necessary forms, and compliance manuals accessible from any device at any time. So, welcome, Will. And I would love to hear about your story. How did you start Elevate Compliance? And yeah, so take it away.
Sure. Awesome. Well, thank you. Yeah, good to talk to you, Doc. And thanks for the introduction. Yeah, so as you said, I've been doing compliance education now for about 10 years. It's actually funny. My background before that was in television and film production. I had very little interest in being a part of the dental industry initially, but I worked on a project once for a company that was filming the proper way to disinfect a dental operatory.
No
And
way.
yeah, and
I didn't know.
at the time I read that and I'm like, well, I don't know what any of that means, but okay, sounds good. We'll go do the video. And I met some pretty amazing people and was like, okay, well, these people seem like this must be kind of a fun industry. And that was my first foot in the door to the dental world. Yeah, and then flash forward 10 years later, like you said in my introduction, I've lectured all over the country from coast to coast, delivered if I had to estimate, probably somewhere in the realm of 4,000 to 4,500 lectures on OSHA, HIPAA, and infection control. In 2017, I think I did the most that year of any year, and it was almost 415, I think, classes I did that year alone. So multiply that by 10 years. I've been doing this for quite a while. But I recently just started Elevate. I actually just left the company that I was with before back in March and started Elevate in April. And yeah, it's been a great ride so far. And as you mentioned in my introduction, my goal, what I wanted Elevate to be, was a much easier way for people to be able to be compliant in their practice. So we built out this really amazing platform. It's all based online. It's accessible from any device. And what makes that really exceptional is when you hire new team members or you do your annual team training, either way, the training is all there on the platform, as well as all of your forms and manuals. Everything is digital. No more, big 4-inch manuals on the shelf taking up space, collecting dust. So if there's something you need, I answered a question for a client just this morning because somebody in one of the offices that I work with had an injury. A needle stick injury. And so I answered one of their questions and was able to direct them straight to the platform where they can just do a control find and look for exactly what they need, as opposed to trying to flip through this giant manual and work it out when you're in the crunch of that emergency. So yeah, I just wanted to make it as easy and simple for people to be able to access what they need and get their training.
Yes, I mean, I love it, Will, because like you, I'm also an owner of a software company,
Yep.
and with practice by numbers, that's what we try to do as well, right? To make things easier
Absolutely.
for our team members, so that when it's crunch time, they're not going helter skelter.
Yep.
And so I really love what you're doing in the compliance field because I think it's really neat and necessary and
Thank you.
and the fact that you're putting it all in one place and it's easily accessible and easy to read, and the fact that any team member, they can create, you can create logins for your team members and have them use it as well. So
Yep. And
you
then
know
the great advantage to that, I also know, like you mentioned, I know that you own Practice by Numbers, but I also know you're a busy dentist as well, still working on the clinical side. We talked a little bit about that last time we talked. And so for you, let's say you have a new hire this week, but you just did your training a couple weeks ago. Well, in the more traditional method of training where you kind of have to figure out now what to do with that staff member, where do we send them? Do we wait till next year? Do we put off our training if we know we're going to hire someone? With the platform, you don't have to do that. You can hire them whenever, get them trained whenever. Just makes it so much easier. So yeah.
Yeah, no, and that's really, really important because sometimes as a busy dentist, and I can say that because I am one, and
Yep.
we wear we wear so many hats, in our business and unfortunately these days in dentistry, there's been a little bit of a revolving door issue with
Yeah.
staff coming and going, that it's really hard or really easy to forget whether your team members have finished their training and are compliant or not. And so
Yep.
this is an amazing and great tool. And I really thank you for creating it so
Well,
that we
thank
can take
you.
off one checklist,
Yeah.
one thing off the checklist.
Yeah, well, and to add on something that you just said, unfortunately, yeah, I totally, from working in the industry, especially since the pandemic, there has been such a revolving door. Turnover is spiking all over the place, it seems like, and the workforce is lower. Everybody's just desperate for team members, especially quality team members. But remember, an office that trains is typically an office with lower turnover. So, I mean, there's so much ancillary benefit that you get from having a compliant practice. It's not just checking the boxes in case an investigator walks in, but you have team who are trained, that goes a long way towards reducing turnover because it's an investment in the team. But not only is it an investment in the team, it helps them understand what the rules are. And when they understand and comply with the rules, the benefit of that cannot be overstated, not just from the turnover side, but saving money from investigations and citations, reduce complaints. There's just so much benefit that comes from it.
Absolutely, absolutely. So what makes Elevate different from other compliance companies out there?
Yeah. So as I mentioned, obviously we built out this platform, and to my knowledge, there's really not anybody else out there who has done it this way. I think there are a couple of companies who are starting to explore it, but not one where you have your forms, your manuals, your checklists for compliance, everything in one place. So like you mentioned a minute ago, we aim to make it as easy as we can, take as many things off of the dentist's plate as we can, just because you have so many other things going on. And realistically, when an office has a new person who's sort of in charge of compliance, it's usually either the new hire who everyone just kind of shoves it all on, or it's the dentist who's trying to take care of it with everything else they have to worry about. Let us handle it. So the platform makes it super easy because, again, you can get at it from any device, which is really great. You can access it anywhere. That's one thing that really kind of sets us apart. But then the other thing that sets us apart is that we're actually based on a subscription model as opposed to a once per year kind of pay as you go system. The advantage to that is, as long as you are a member on the platform and you have that subscription active, not only do you have access to the platform, but I will also represent you, write appeals, and handle citations if you get any of those.
Oh,
So
wow.
it's kind of an included process. Yeah. And there's no additional cost or charge for that. It's included in the subscription fee. And so again, it just, if your office and your offices wouldn't have to worry about this because I've seen your offices, they're perfect. But if you had an investigator come in, and if another dentist out there had a citation in their office, they can contact me directly. I'm happy to write the written responses and appeals for that. And it's included. So it's an all-in-one package. It's not just get your training. It's not just get your manuals. It's get your training, your manuals, your forms, your safety data sheets, frequently asked questions library, and representation if there's any issue in your practice. So really what sets us apart is we're with you through the entire compliance journey from start to finish. There is no, sorry, we don't handle that, answer to questions that you have. So that's kind of our approach.
Wow, that's amazing. That's amazing. So you truly are one-stop shop. So that I
Yep.
love, because we need that. We are many times as dentists left out to dry when we need help with, if problems do occur with citations and things, then we're scratching our heads trying to figure out who to turn to, how to get
Yeah.
this organized, and who to get help with. And so it's great that you are able to provide that as one service folded in. So I love
Yeah.
that. I love
There's
that.
there's so much like buck passing that goes on sometimes, right? Oh, we don't handle that. Talk to them, and then someone else refers you to someone else, and you're just trying to get your answer. You just want to get it dealt with. We don't want to have all that, run around going on. So we're gonna take care of you.
Awesome. Awesome. I love that. Because we dentists need some taking care of, really. We do.
Well, you got a lot on your plate, like you said. I mean, I think you said something like you wear lots of different hats or something to that. You alluded to that kind of And that's just so true. I mean, you're running a business, you're also trying to hone in and sharpen your clinical skills. You have that, as a major focus. And then for someone like yourself, if you also have a business venture on the side as well that you're trying to run and manage, and you've got a team there, you've a couple of different teams you have to manage. So let us take this really big headache off your plate and just make it easier for you.
Awesome. Awesome. And you guys are not just, and I know that I'm in Washington, you're in Washington,
Yeah.
but your business is not just for dentists in Washington, it's for all dentists all over the country, right?
Yes. And so right now, unfortunately, for any of your podcast listeners who are outside of the United States, unfortunately, we can't help with any of those, docs yet. That's maybe in the plan for down the road. But right now, yeah, all 50 states, we operate in all 50 states. And, again, like I mentioned, we had a client who had an employee who had an injury earlier today, and they were based in a different state than Washington. Well, all the states have their own sort of nitpicky differences in the way that they operate. So we understand all of those. And I have easy access to be able to kind of figure out what the differences are. If something comes up in Kansas or something comes up in Florida, the rules are going to be a little different there. We can handle that. So, yep, we operate nationwide, and HIPAA is easy because HIPAA is a federal law anyway. But when it comes to OSHA and the differences, again, like you mentioned, we here in Washington, we actually observe our own state rule called WISHA as opposed to
Right.
OSHA. And sometimes I'll accidentally slip up when I'm in another state and I'll say, don't forget about your WISHA. And I'll have to correct myself. And people are like, what did he just say? What the heck is WISHA? So every state works a little different, but yeah, we're familiar with all those differences. And yeah, we work coast to coast, Hawaii, Alaska, everywhere.
Wow. That's awesome. And you don't have to travel everywhere. You can do this over Zoom. So it's
Yeah,
cool.
we can do it over Zoom. And again, we do have on the platform pre-recorded training as well on demand. And so, like one of our clients in Tennessee, they just did their training over 3 days instead of doing it all at once. So over Monday, Tuesday, and Wednesday's lunches, they did OSHA training on Monday's lunch, HIPAA training on Tuesday's lunch, infection control training on Wednesday's lunch. So it just takes an hour per course. And then that way it didn't interrupt their, they didn't have to cancel or reschedule any patients. They were able to just do it all on demand. And our courses are really cool because when I can physically train you, either be in person or on a Zoom call like this, there's so much, obvious more engagement than you're going to get from an on-demand course. So what I wanted to do was make those courses more approachable. So it's not just a video that you watch for 60 minutes where your whole team is dozing off trying to stay awake the whole time. They're very engaging videos. They have knowledge checks kind of throughout. And then there's games. We focus a lot on like gamification and really making the training enjoyable. And our client, like I said, the client in Tennessee who broke the training up over 3 days, man, they loved it, and they loved the interactivity and the games, and just it stuck with them a lot more. They told me we have so many things that we didn't even know we had to do, and we've done OSHA training for years, and we didn't know that we were missing these things. And probably that's just because they were so much more engaged. So yeah, I really want to make the training as engaging as I can. So yes, to your point, I don't have to travel as much, which is very nice. I can do it via Zoom. I can also travel and do it in person if that's what the client wants, or we have on demand. So kind of cover the spread.
That's awesome. That's awesome because, I had, you will come into my office personally and do the training, and it was great. You're such an interactive and engaging educator that it's
Thank
been
you.
awesome. And it's even great now that I can tell my staff I have Will on demand.
That's true. Absolutely. Yeah.
That's awesome. So in addition to services like the training and the online digital manuals that you have, what else do you offer your clients, especially when they're faced with investigation?
Yeah. So, well, as I mentioned a few minutes ago, we cover through writing responses and appeals for investigations and citations. So, if an investigator comes into the office and does find something that was maybe missed, wasn't taken care of the best in the practice, if they cite you, there's a few different processes that we can follow there, sometimes to get the fines reduced or even eliminated entirely. But at the very least, you want to respond. So even if a practice goes, hey, you know what? Yep, throw our hands up. Yes, we made that mistake. We'll pay the fine. We'll deal with it. There still needs to be, a professional response back to the lawmakers. And so we can write those for you as well. So we really want to try to kind of take that off the plate as well. If there is an issue in the office, we can handle it. We can contact whoever it is who cited you. So that's kind of one piece of it. And then we're also adding constant content. So I mentioned that we're a subscription-based service, and sometimes, everything is going subscription these days, right? Everything seems to be, and I've gotten some feedback where people are like, "Oh my gosh, why do you have to do a subscription?" Well, the advantage to doing a subscription is not only are we accessible all the time, right? And again, it just makes it a little bit easier for us to track where our clients are, but also we add additional content to the platform all the time. So back in May, we just released our first new course, which is our Clinical Compliance Coordinator Certification course. I know it's a really long title. I tried to condense it down in any way that I could. It just didn't work. So we kept the long title. And then coming up in just a couple of weeks here in early July, we're going to be releasing a chart compliance and self-auditing course, which really helps the team understand on the charting side, making sure that all the things are, all the sort of benchmarks are hit for making sure that charting is compliant as well, because that's a little outside the purview of HIPAA or OSHA, right?
Yeah.
And I'm sure you've had in your dentisting career over the years, I'm sure you've had maybe nothing that's actually been followed through, but sometimes a patient will complain about something in a chart, or they'll complain, or they'll threaten to complain if there's something that they disagree with in the practice, whatever it is. And chart notes can go a long way towards protecting the dentist, towards protecting the practice, and resolving those patient situations. So that's coming up. And then later in the fall, we're going to have, there's been some updates to the suicide prevention training in dentistry. For dentists and hygienists, we have a course like that that's going to be coming up with all those changes in the fall. So we're constantly adding, more and more content to it. So it's not just compliance for OSHA, HIPAA, infection control. Yes, those are the bread and butter, right? To use a dental term, the bread and butter of what we do. But of course, we want to add more to it. We want to be valuable to the practice all the time, and so more continuing education, an easy place to access it. And then again, that follow up, if there ever is a citation, is really, our goal to see it all the way through.
Wow, that's an amazing vision, and the fact that you're actually taking the time to do this, that's really great. Really, hands off to you.
Well, thank
Because
you. It's been a lot of fun. It's been so much fun putting it all together. Yeah.
yeah, because I mean, these things are really important, and there are not that many people that think about it, or even if they think about it, then we are kind of, we get these emails, as you know, from our state dental association saying, hey, these changes are coming. Make
Yep.
sure you register for courses or get the courses done so that you're compliant. And then you're like, oh, great, now I got to find somebody who can help me
Yep.
get compliant. So, and this is really awesome. And you guys keep up to date with all of that, right? All the new things
Oh,
that are
yeah.
coming out constantly. And do you have like reminders and stuff that you send out to people that are signed up with you that, hey,
Yes.
this is coming up?
Yeah. So one of the things, that I try to avoid is being too much of an inbox filler, right? Especially because, emails get missed, especially when you have just tons of them coming in every day. So I try not to do, we try not to do too much of that where we're just kind of bogging down your inbox, because we know that our communications are going to get missed in that way too. So we have a way through the platform to communicate with our clients, which is kind of neat.
Mhm.
It actually works just like a forum would, just like anything else would, whether it be, a communication in Facebook or on Reddit, something like that. We have a forum within the platform to communicate. We also have checklists for every practice. So for your practice, for example, there's a checklist that says, hey, have you done your annual training? Have you had what about this new course for compliance coordinators? Have you done your risk analysis for the year? So we push those out to the practices via the checklists as well. So it encourages you to come back to the platform regularly, take a look, because, again, those emails will get missed sometimes. So yeah, we communicate that way. We do send regular notifications out, especially if there's something really major. Like just just last month in May, OSHA changed the way that the hazard communication standard worked, and ultimately it really didn't change much at all for dentistry, but kind of more at the top level as opposed to down at the user level. But still, it was a change. It was a change regardless, and so we put that notification out, altered our course, of course, just to make sure that it always includes the most up to date information. So, yeah, and we're always dialed in with all the rule changes, everything. I'm checking it daily, and part of my morning routine over my coffee is looking, okay, any news from OSHA, any news from HIPAA. And most of the time, I'm sure the
Oh,
people listening
joy.
are thinking, oh my gosh, what a terrible thing to do over your coffee. But I find some enjoyment out of it. It's kind of like my version of a morning crossword puzzle, in the paper. So
That's great. I am glad that that's your version of CrossFit personally
Yeah.
because we need that, because it's
And
definitely
usually
not
people say we're glad you do that because we don't want to do that.
good.
So yes.
Yes. And so if our viewers want to, or listeners want to get a hold of you, how do they do that?
Yeah, so there's a few different ways. Obviously, you can go to our website, elevatecompliance.net. That's our website. And the website's fairly simple. It's basically just kind of an explanation about what we do. You can use the contact form there. You can also email me directly. It's just will@elevatecompliance.net. So shoot me an email. You can find us on Facebook. You can find us on Instagram and LinkedIn. So connect with us on social media. Again, anyway, on Dental Nachos for all the listeners who are Nachos fans, and we're sponsors of Nachos as well. So there's lots of different ways to get a hold of us.
That's awesome. That's awesome. Well, thank you so much, Will, for making compliance interesting and accessible and making our lives as dentists a little bit easier, at least in this sphere, because it's really needed and important. And the fact that you're keeping up with it over your daily coffee, that makes me sleep better, really. So it's really, thank you so much for coming in and looking forward to chatting with you soon.
Yeah, thanks, Doc. Appreciate you having me. And again, thanks for everybody listening in. Take
Take
care.
care.